Experts say the best way to get the economy going and the U.S. workforce back in their offices during this pandemic is coronavirus testing. Labcorp announced it has a new at-home COVID-19 test called Pixel. With us now to discuss the test is Dr. Brian Caveney, Chief Medical Officer and President at Labcorp. Doctor, thanks for joining us. So, two-part question: how does the test work, and how much does it cost for consumers?
Sure. Well, what a pleasure to be with you. Labcorp is just so proud to be working 24/7 to help the country and world address this crisis, and getting access to appropriate testing, as we all know, is a really important part of it. We're delighted to have worked closely with the FDA to release the very first emergency use authorization of an at-home self-collection kit, where a person can essentially take the swab themselves, place it back into an appropriate container, and very quickly ship it back to us in certain shipping materials so that we can process it in the lab. We're able to access that directly from our website after filling out some information to make sure it's appropriate for the person being tested, and then it's sent in. We're currently only charging the published Medicare rate for the test itself, which is $100, and then some extra charges to handle the special packaging and insulation materials necessary for quick overnight delivery through FedEx directly back to our laboratory.
Doctor, is this a test for those people who have COVID-19? Are you testing to see if they are indeed positive? Is it an antibody test? And what does one need to do? Do they use saliva? We've heard about some tests like that, where you would basically spit onto something and then send that into the lab.
That's such an important question because, as you pointed out, there are multiple different types of tests now. So the test that we released yesterday, called Pixel by Labcorp, is very specifically looking at the secretions in your nose for the actual virus. So it is the test called PCR technology, which detects the virus and can actually diagnose you with COVID-19 disease. There's a separate group of tests, which we also now offer, that are blood-based instead of nasal swab-based. And those are looking for proteins in your blood called antibodies, which is not the actual virus. It is just suggesting that your immune system has seen the virus before and has developed these antibodies to help fight against it.
Dr. Angeline here. I'm curious about how this fits into the narrative that we've heard about shortage of supplies. Walk us through, how you're able to ramp up the production of this and distribute it.
Sure. Those are two very important things. There has been much made about the capacity of testing, and Labcorp and other labs have dramatically increased the amount of testing capacity available in the laboratories. But often some of the problem has been on the very front end, whether it has been a shortage of the actual swabs and specific solution needed to protect the swabs, or just people's ability to go to a healthcare provider who's able to collect the swabs, given that so many physician offices and clinics across the country have essentially closed their doors and are doing telehealth only. The beauty of our at-home self-collection kit is, after you have gone through the screening questionnaire on our website, the kit shows up at your house and you're able to do the swab yourself. So you basically use it sort of looks like a Q-tip. It's a validated cotton swab that you rub on the inside of both of your nostrils to get a good amount of secretion, put it back into the packaging, and then quickly FedEx it to our lab so that we can process the specimen.
Great. And I'm glad you brought up telehealth, because that's one of the things I think we're really focused on right now is the adoption of it and whether or not it sticks post-outbreak. On that same note, though, at-home collection is also an area where not just yourself, but your competitor Quest is also looking into. So do you think that this is sort of the future where we're looking at more self-administration of testing at home?
I think in every aspect of life, people are looking for convenience and speed and value, and that is certainly no exception in healthcare. We have been very active in this space for several years, actually, on a variety of different testing mechanisms, from wellness panels to certain cancer screening protocols, et cetera. The COVID-19 is just another example where, with so many people sheltering in place at home and with so many medical clinics being closed right now, there's been a significant increase in the usage of telehealth, which I think net is a very positive thing for the American healthcare system, so people can get good, quick advice very quickly. We've integrated over the last several years with most of the major telehealth platforms so that actually those clinicians can order laboratory testing and send their patients to a convenient access point at one of our patient service centers. COVID-19 for the serology testing will be in that category as well, where we'll be able to do the phlebotomy for the blood-based testing going forward, even through telehealth. We've also partnered with many of our physician customers across the country who were already Labcorp customers. And, you may have seen the Labcorp box on the back of their clinic if you've gone in person. Well, because we're already interfaced through their electronic medical records for electronic orders and results, many of those customers are now able to order laboratory tests for their patients directly to us without the patient having to go to the clinic. They can just simply come to one of our patient service centers to have their blood drawn or their urine taken or whatever test their doctor may be ordering. Particularly now, there is a significant number of people that perhaps have not been taking care of all of the other chronic conditions that they have because they've been sheltering in place and or have not gone for normal doctor's appointments. Telehealth and the ability to get laboratory work without having had the in-person doctor visit enables them to get access to that.
All right, let's leave it there. Dr. Brian Caveney, Chief Medical Officer and President at Labcorp Diagnostics. Good luck with the test. Very important work you're doing.
Thanks so much for what you're doing.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.